Good afternoon. Welcome to our second medical career panel discussion. My name is Maria Saltos Mowry. I'm a registered nurse. I will be hosting the panel discussion. We will introduce our panelists in a little bit. But the reason why we started having these and the Miami Temple Health Ministry Department received requests from the young people in our church saying that many of them were interested in medical careers. And as many of you know, the medical field is very vast and there's lots of options. So because of that, we decided to contact professionals that we knew that had attended our church or just, connections. And we decided to get together small panels of discussion where we talk about our careers and what to expect. So we are hoping that these conversations have been useful. We already had our previous one. You can find it on YouTube. And this is our second one. So now we will bring the rest of the panelists on the screen so you can meet them. Thank you and welcome to our lovely panel. We will be introducing you guys shortly. Let me see, who should I start with? Dr. Gerson Diaz. I will go in the order that you all appear on my screen. All right, Dr. Gerson Diaz graduated from Rife University in March 1993 with a degree, Doctor of Chiropractic, which is DC. Graduated undergraduate from Florida State University with a bachelor's degree in biology in April 1989. You are dating yourself, Dr. Diaz. He is now the owner and the president of Cutler Ridge Family Chiropractic Center since May of 1994. For those of us who have been attending the same church as Dr. Diaz, we have all made rounds in his office. He is fabulous. He specializes in correcting vertebral subluxations, which basically means spinal misalignment in patients' spines. Those are caused by a variety of reasons: physical, chemical, emotional stress. And in addition to pain, it may cause other conditions in the body. So Dr. Diaz says, I see patients from the womb to the tomb. So his motto is the power that made the body heals the body. So thank you for joining us, Dr. Diaz. We are looking forward to hearing more about your career. Dr. Mccalla, Dr. Len Mccalla. He attended and graduated with honors from the Greater Miami Adventist Academy from high school. He next attended Andrews University, where he earned a bachelor's degree in biology in 1979. After graduating, he spent the next 2 years employed as a lab technician in the neuroimmunology lab of Dr. William Shermata. There, he conducted research looking for a possible immunological origin of multiple sclerosis. He next attended the Southern College of Optometry in Tennessee. A Dean's List student, he earned a master's degree in visual science in 1983 and a doctor of optometry degree in 1985. The next year, he completed a residency in primary eye care at the Memphis Health Center. He is currently a member of the National Optometric Association, the American Optometric Association, I already said that, the Florida Optometric Association, and the Miami-Dade Optometric Physicians Association. He is a member of Beta Sigma Kappa, the Optometric Honor Society. Dr. Mccalla is married to Dr. Judy Mccalla, who is our fearless leader, a clinical psychologist in private practice in South Miami. They are blessed with a son, also Dr. Derek Mccalla, a pediatrician in Loma Linda, California, a daughter-in-law, Janae, and a granddaughter, Shala. Welcome, Dr. Mccalla. We look forward to hearing more details about your career. Thank you for joining us. I will go to Corinne Mccalla. Now, Miss Crean. Are you related to Dr. Mccalla? Yeah. Kind of like cousins, like kind of, like, yeah. We have a lot of Mccallas in our church, in case you haven't noticed. Okay, Corrine Mccalla is a proud alumni of the University of Central Florida in Orlando, Florida, where she pursued her calling in communication sciences and disorders. For the past 10 years, Corrine has served the Miami community as a pediatric speech language pathologist and is currently a therapist and clinical director at the Hearing and Speech Center of Florida. Corrine loves the many sides of speech pathology and loves helping patients discover their own way to communicate in their world. So welcome, Corrine, Miss Corrine. We look forward to hearing more details about what you do at work. And Dr. Dwight Salmon. He was born in Jamaica. He attended West Indies College, which is now Northern Caribbean University, for his first year of college. He then attended Columbia Union College, yay, CUC, now Washington Adventist University in Maryland, where he completed his Bachelor of Science in Medical Technology. He completed his DDS degree at Howard University and attended the University of Rochester for postdoctorate training in advanced general dentistry. He has practiced dentistry in North Miami for nearly 30 years. Now, Dr. Salmon, welcome to our panel. I am so excited that you were also from the Maryland area. That is where my husband and I are from. And we both attended CUC. So good to have you on board. All right, so now we will start with the questions that we have prepared for you. And the first one should be showing up soon. I would like for us to start in the order which we are. So starting with Dr. Diaz, followed by Dr. Mccalla, Dr. Salmon, and then Ms. Corrine. And for the next question, maybe we can do it backwards, okay? So the question is, what made you choose your career?
All right. Chiropractic. Most people don't really know much about chiropractic. I remember as a kid, I was about 10 years old. My mom wound up having excruciating back pain. She had a herniated disc. She wound up spending a couple of nights in the hospital, and she spent about a couple of months just in a lot of pain. I remember my dad and my oldest brother would have to take her to the bathroom and back to the bed. And I was like, wow. At the hospital, the doctor says, we need to do back surgery. If we don't do back surgery on you, you're going to be in the wheelchair for the rest of your life. And I was like, wow, so my dad tried other options. And he's like, somebody said, well, why don't you take her to a chiropractor? And my dad's like, what's that? I've never been to a chiropractor. He took her to a chiropractor. After 2 adjustments, she was doing much better. This is 45 years ago. My mom's turning 85 now in October. Didn't have back surgery, is not in a wheelchair, and she's doing great. And that really impressed me from a very young age. I'm like, wow, there's something to this. So that's what made me decide to become a chiropractor.
Thank you. Thank you so much. It's always more meaningful when you make a decision based on your experiences, whether in your family or something you've observed from someone who's close to you. So thank you for sharing. Dr. Mccalla.
Well, for me, this can take a while. I had the experience of going with my brother as a young child and watching him come out of the optometrist's office and being able to point at things that he'd never seen before because they were so far away, like the steeple of a church, and how ornate it was. He didn't realize that, that it was very beautiful. He couldn't see it. And we've been living there for months in that area. And then my own experience, I went through that growing up. There's a period of time I became nearsighted, and so my distance vision was blurred. I had trouble with school, and for a couple of years I needed glasses, and I actually did not get them until a couple of years after I initially started being blurry in class. But the reason why I made my decision to do this is actually because of research I did when I was in 11th grade. I went to Greater Miami Academy. It wasn't Adventist Academy back then, it was just Greater Miami Academy. It was a different building where we are now, but our teacher made us do a term paper. And this paper took almost the entire year to complete. We had to go research it, go write letters, dig up the card catalog, and do a lot of research. I wrote the American Optometric Association just to find out information. I just wanted to do my paper on something that was different, that not everyone would be doing their paper on. And so I figured if I did it on a different area, I would get a better grade, rather than if I did it as let's say a policeman, everybody else is going to do a policeman, or a nurse, there'll be many other people doing that. So I wanted to do it on something different. And so I did it on optometry. And I fell in love with it from then for several reasons. First, it's in a health field. That's what I wanted, something in the health field. Demographics. Once you're over 40, we have a saying in optometry, we got you. Because you're going to need glasses. We got you. Once you're over 40, if you start out without it, at some point we got you. So everybody, 100% of the people will need correction if they are to see properly. The income was good. I looked at income too. I looked at prestige. Yes, you're going to be a doctor, and that was important to me too. The hours were good. I didn't want to spend the rest of my life in a hospital, or morning and then back at night and getting home late from a hospital. I wanted better hours. So I looked at something that would give me that. And lastly, I wanted to help others. And this was a field where I could do all of these things, and it fell right into my lap. And I thank God for it every day.
Thank you so much. And most of us do wear glasses, so we appreciate doctors of optometry. Yes, we really do. All right, Dr. Salmon, what made you choose your career? Dr. Salmon, we cannot hear you. I'm sorry.
I'm sorry. From high school, I was pretty much intrigued by several other professions or careers other than dentistry. Dentistry was never on my in the forefront. First, I really admired piloting or being a captain of an aircraft, and I said, you know what? One day I'm going to fly for Air Jamaica. I was living in Jamaica at that point. In the 70s, we moved to Florida, moved to Maryland. And I said, you know, I'm going to go to school. I'm going to major in medical technology. I think I'll enjoy working in a hospital. But after working in the field of medical technology, it was kind of a boring field. It was great training, but never really enjoyed it. So I said to myself, let me do veterinary medicine. Veterinary medicine is what I think I would like. It's outdoor, it's me, it reflects my personality. Never looked at the income, never looked at anything, but just said, let me do veterinary medicine. One day, a friend of mine came to me and said, Dwight, let us go and do dentistry. Let's go to Howard and University and do dentistry. Let's think about dentistry. I said, why dentistry? And then I thought back of all the people that I have encountered as a patient. I said, that's not a bad profession. Decent hours, they're busy, they're doing okay. Began to do my research. This is back in the 80s. And I realized that if I return to Jamaica to practice dentistry, there's only 60 dentists for 2.5 million people. 60 for 2.5 million people. I said, I have to do okay. I can't really lose. So I said, I'm going to go and apply for dentistry. When I began to do more investigation, I realized that it's really, really great. It's really an art form with great knowledge. So I applied to Howard University, got in, and did dentistry. Well, I'm still here in Miami. I have not gone back to Jamaica yet, but I'm still having fun with dentistry.
Well, we appreciate having you here in Miami for sure. All right, Miss Kareen, what made you choose your career?
It started. It was I would say an evolution. It started off wanting to be a teacher in elementary school. And then in middle school, I really started to look more toward special education. I was interested in helping children that needed a little bit more attention or a different way of learning. And I was also interested in communication. I think that seed was planted when at church we used to do a little sign language ministry. So really looking at a different type of communication. And then in high school, that changed when I was experiencing or when I was witnessing some kids in my school having difficulty. They were in the special education unit and having difficulty interacting with the rest of us in the school. And I really started to think, I want to do more than just special education. It's a very broad field. I want to do something a little bit more impactful in a sense. And I was looking at what could have benefited these students in connecting with us, and that was communication. And so starting in high school, that just really solidified what I wanted to do. And I got an opportunity in high school to visit my sister, who at that point decided that she wanted to be a speech pathologist after me, of course. But I got to visit her in college and at UCF, and I got to go to some of her classes. And it was there, seeing some of these professors that I later on had, and just sitting in and absorbing everything. And that's when that was it. One, that was a school I wanted to go to, but also this is where I wanted to be. So yeah, that's how I got here.
Thank you, Miss Corrine, for sharing. It's interesting how all of us just arrive at the certainty of what we're going to do. Some of us, it may take a little bit longer to get there. Others, again, based on their experience or what we've observed. So we do appreciate everything that you do. Your patients appreciate everything you do, I'm sure. Corrine, you have like the cutest patients. You do. They're adorable. All
Unless
right,
they're in the middle of a tantrum, then they're not cute.
Yeah, but those of us who have kids, they're so cute, All right, so the next question. What steps in schooling did you have to get through to what you do today? Sometimes it's like a shorter field. Other times it's like many, many years of study. So starting with Miss Corrine, let's see what you had to do to get to where you are.
I believe I'm the shortest out of all of the ones on the panelists today. On average, it takes minimum. It takes about 6 years from your bachelor's onto your master's. For speech language pathology, you do have to have a master's in this field in order to work as a certified speech pathologist. So you have the opportunity to start off with your bachelor's in communication sciences and disorders. There are some who do start off in education, start off in psychology, in different fields, but then they decide to have a change of heart or a change of calling, and they switch over. And when that happens, of course, you have to take certain courses that are needed before you get into the grad school program. The grad school program typically takes 2 years. They do have a longer 5-year program for those who are already working in the school system. It depends on where you are in the state or which state you're in. And what else? After you graduate, you are also taking a praxis test. Basically, it's your boards for speech pathology, and then you have to do your clinical fellowship internship. That's about 9 months where you are working as a speech therapist, but with some supervision. And then, should you choose to be a part of the American Speech and Hearing Association, or ASHA, that's when you apply for your Cs, which is your Certificate of Clinical Competency. So normally it takes 6 years. Some people do more accelerated if they can, and some people take a longer route if necessary.
I'd like to make ask a follow-up question on that. You said you need a master's, correct?
Correct.
A master's degree. Last panel, we had a physical therapist, and they usually have to get their doctorate in speech pathology. Do they encourage you to get a doctorate, or how does that work?
It's it's encouraged. It's encouraged in the sense of they get excited if they hear that you want to take the PhD route, simply because research is always needed. In whatever medical field we're in, but research is needed to make sure that we're doing enough evidence-based practice. So they do encourage it. Most of us don't. It's not a requirement. It's you can work as a master's level therapist. We also do have an SLPA, which is an assistant certification. That takes about a year and a half, depending on the college and the courses that they give you. And that's if you want to do something in the meantime. But to be a full SLP, you have to go through the whole process.
Thank you so much. Dr. Salmon, your turn. What steps in schooling did you have to get through to do what you do?
In my field, and as it pertains to me as a child growing up and being educated, I always enjoyed the sciences. Did well in pretty much everything, but the sciences to me was more practical. It made sense, and it seemed to be more applicable than history and other courses of studies. So pretty much you need a strong science background for anything in the medical field, which I had. Did dentistry. In terms of dentistry, it's best to have a strong college science degree. You apply to dental school. Once you get into dental school, then you go through the first 2 years is similar to medical school or just like medical school. You take an exam, national boards at that point of examination. You continue through the other 2 years of training. You take another board, second national board. Then you graduate. Then you can go on to specialize in different fields of different specialties of dentistry. Some of these specialties may require anywhere from 1 year to 4 years or 5 years additional course study. At which point you take another exam that would qualify you as a specialist, and you've pretty much finished with your training. Then at that point you now have to keep up with your degree, keep up with your knowledge, which would involve continued education in your area of interest.
All right. So let me ask you a question. Did you follow any specialty, or are you just general dentistry?
For me, I had a difficult time picking a specialty. First, I had an interest in periodontal therapy, gum treatment. Then I had an interest in orthodontics. I just could not pick a specialty. I went to specialize in general dentistry, hoping that I would be able to narrow my choice down, but I just could not. I just could not see myself doing orthodontics all day. It's already a narrow field, and I really enjoyed all aspects of dentistry. So I just didn't specialize, and I'm very happy with the decision that I made. Yeah.
Thank you so much, Dr. Salmon. Dr. Mccalla, your turn. What schooling did you have to get through to do what you do?
Well, of course, you graduate from high school, college. When you the program you take in college is similar to medicine. You must have calculus. You must have the physics. Physics is very, very important in my field because you deal with the physics of light, how light works, telescopes, microscopes, lasers. You have to understand all of those things fairly well as we're being trained. And so those were the classes that I took in college. Then after graduating from college, I went on to optometry school, but my 2 years that I worked actually helped to train me. I worked in the Department of Neurology, and it helped me to get a better understanding of how the brain connects to the eyes. And it's part of the eye. The eye is part of the brain. We always like to separate those organs, but they're actually part of the brain. All of those organs in our head, they're part of our brain. So that helped me to understand quite a bit more. And I think it gave me a leg up in what I do. Then when I went to optometry school, the first 2 years, it's just like medicine, the same anatomy and everything. In fact, the University of Alabama, they have an optometric, a dental, and a medical school all together. The first 2 years, there's a large class, and they all take the same classes together, exactly the same thing. Then they branch off after that. So after the first 2 years, we have a national board that you have to take, part one. And then you go on and do the third year. You can take part two then, after the third year. And then at the fourth, sometime between the third and the fourth year, anytime in the fourth year, you take the last one, the third national board. So we have 3 national boards to pass. If you don't pass your national boards, you can't sit for the state of Florida exam, or most states. So you have to pass the national boards first. After you graduate or whenever you do, some point you have to pass your national boards. Then you must have graduated from a school of optometry and have passed your national boards. Then you can sit for the State Board of Florida, which was a very difficult exam. Florida is probably the most difficult state to get into, one of the most difficult in our field, because they're trying to be exclusive and exclude as many because everybody wants to come to Florida. That's where all the old folks are. That's where all of them need glasses. They all need medical care. So that's where people want to come to Florida. So we're the type of state that pushes people away. We don't allow a lot of people into our state. And so that's kind of the training. I also did another year of what we call primary eye care. It's specialization, where I spent time with a doctor of internal medicine, 6 months with him, and also at an optometric clinic for indigent patients. And so I went back and forth. It's connecting how general diseases affect the eyes, things like sarcoid, lupus, MS, diabetes, hypertension. So all of them have manifestations in the eye. And so that's part of the training that I took. And that's it in a nutshell. If you want to do optometry, you're going to be having to go through some strict courses and exams, but it's nothing that's impossible to overcome if you have an interest in the field.
Thank you. Thank you so much, Dr. Mccalla. Our last panelist, Dr. Gerson Diaz. What schooling did you have to get through?
Wow. I was going to say ditto to a lot of the stuff that Dr. Mccalla said, because science, calculus, physics, biology. I was a biology major in college, but, it was a lot of pre-med, biology. We were all together studying. So it's very similar to the medical field, the undergrad. My minor was in Latin, and Latin helped me out a lot because of all the medical terminology that we use, in undergrad and in chiropractic school. And even now working in the medical field, everything is Latin. All the medical terminology is in Latin. So if you struggle with Latin, it's the same thing worldwide. Latin is the medical term. So that helped me out a lot. Chiropractic school, same thing. The first 2 years is all the anatomies, the physiology, same, very, the gross anatomy, very similar to medical school. We switch later on. We do a lot more radiology the last couple of years when the patient care, the adjustments, and we concentrate more on the anatomy. But a lot of the radiology, we do a lot, no pharmacology, but radiology, anatomy, physiology. We do part one of the national boards. We do in the second year, just like Dr. Mccalla. Part two, we do in the third year, and part three of the national board, we do between our third and fourth year before we graduate from chiropractic school. So it's 4 years of undergrad, 4 years of chiropractic school, and you have to pass 3 parts of the national board before you can sit in the state board. Florida, like Dr. Mccalla said, is very exclusive. The Florida Board of Chiropractic is one of the hardest. I think it's probably the hardest in the country. Very, very exclusive. I have my Georgia license, which I took to practice. I practiced that exam so that I could practice for the Florida board. Once I took the Florida board, it's in Florida you're not a chiropractor, you're a chiropractic physician. It's a medical physician's exam is what I took for Florida, as opposed to when I took the Georgia board is more just setting up for adjustments and radiology. The Florida exam was a complete medical exam. So lots of different. So they are very exclusive. Now there's a part four of the national boards. So that part four will allow you to practice in any state. But when I was practicing, it was just a part three, and I had my Florida and Georgia licenses. I had to intern here in Florida for a year, so it was 4 years of undergrad, 4 years of chiropractic school, and then a year of internship before I actually got my license and opened up my practice. And every year I have to continue do my continuing ed to maintain my practice because things are always changing. The en vogue thing at the last license renewal and the last continuing education was human trafficking, and how to see that in the patients, and it's you see how the landscape is changing in this crazy world. But yeah, we're constantly having to stay up and keep up our license every 2 years.
Thank you so much. And those of us that have continuing education, we feel your pain.
Maria, I'd actually, that was something I wanted to add, is that along with all of them, I think everyone that is in the medical field in some way, shape, or form has to continue with their continuing education units. It varies by state and also by profession on how many you have to do every 2 to 3 years, depending. And for many of us, we have to do it for state and also for national. But the good thing is they overlap. For some of them, they can overlap. But with speech pathology, like Dr. Diaz in his bio, we do work from the womb to the tomb. We have opportunities to work from the womb to the tomb. So if you, after grad school, decide to specialize in something, or you can take additional courses or certifications to specialize, whether you want to do feeding, or you want to do like a feeding specialist, a voice specialist, whether you want to work more with tracheotomy patients, or if you want to work with the premature babies still in the NICU, working on swallowing. There's so many different aspects in the speech pathology field that you can specialize in once you're done with grad school. So it doesn't stop there. And with all of our medical fields, learning never stops.
Right.
Never.
Learning never stops. Yes.
No.
Because we don't become stagnant. I mean, there's so many new discoveries in our careers and the newest research. And yes, we're constantly learning. Absolutely.
Yeah.
All right. Well, thank you for sharing all those details. We're going on to our third question.
I think. Sorry, I think there was a question in the panel. I'm not sure if we wanted to. In the comments.
I don't see anything. Oh, there we go. Okay. All right. It says, if you start in Florida, but then move to another state, what do you have to do to be able to practice in your new location? I think Dr. Diaz covered a little bit about that, but what about the rest of you?
Well, I actually, now that I've been practicing in Florida for over 5 years, I can actually reciprocate my license to another state as long as I pay, all the fees and everything, and show that I've had my license here in Florida in good standing, which I've had. So,
in my field, we don't have reciprocity between states. If I'm licensed in another state, then I can move to that state and practice as long as I keep up my continuing education hours. But if I want to practice in another state, I have to sit and take the exam again.
Wow.
Pretty much each state has their own individual requirement. So practitioners have to look at each state and see what the requirement is.
Okay.
Yes, in speech pathology, you have to have a license in that state. We do not have to take any extra boards or anything for a particular state, but there are certain requirements, like he was saying, that we have to adhere to for that state. There's this whole thing now with telehealth and telemedicine for speech pathology. If you want to provide services in another state via telehealth, then you still have to have a certificate, your licensure in that state in order to do that. So that's something to think about as well.
May I make a comment? Yeah, part of the reason Florida is trying to be exclusive. So if they want another state to accept their doctors, they would have to accept the other states, and they don't want people moving in just so easily. So that's why Florida is not going to do that. The problem, there's another issue also. We don't accept telemedicine here, but yet you may see a place that advertises it. You go there, and there's no doctor there. They're doing telemedicine. Well, they're actually doing something illegal in the state of Florida, but they can't go after the doctor because he's in another state. So they've been able to get away with it, but telemedicine is illegal here. So they have a doctor, maybe in New York, who's seeing patients here in Florida by telemedicine, or Texas or some other state, but they don't have one in Florida seeing their patients by telemedicine. That's not acceptable here.
Wow. You know, this pandemic has opened doors and has exposed a lot of issues, apparently. Okay, so now we must be careful. We can't do telehealth with a random doctor. Thank you for that, Dr. Mccalla. Okay, here comes the fun part. Describe what you do in a typical day at work. And actually, I'm going to start with Dr. Salmon. We'll go with Corrine, Dr. Mccalla, and we'll end with Dr. Diaz.
On my typical day in the office, I start usually at 9 o'clock in the morning. And I pretty much have like two half days for the week, and then no weekends. But on a typical day, you see a variety of patients. You may walk in, you may see a child in the morning, because usually they want to come in the morning where they can go to school afterwards. So seeing a child in the morning is a routine thing. Can be a difficult experience depending on the child. The child's behavior, the child's development. You may now move to a different room. You may see someone for surgical consultation. You move to a different room. You may see someone for a root canal. You come back to another room. You may do some surgery. So the day keeps rotating. It can be full of surprises, because for me, I really don't check the schedule in detail, because it really doesn't make that much of a difference. If there's a procedure to do, you just do it. But the point is that there are a variety of procedures, and that's what makes general dentistry fun, because there's always something exciting going on. It is so exciting where, to me, it's not really working. It's just trying to go through, a fun part of the day, move on to the next part of the day, which would be not working. There's always something exciting going on in each room.
Okay. Ms. Corrine?
In a typical day's work, it depends on whether it's the summer or the school year. At my office, most of our clinicians, we are out in the community in some capacity during the first half, or the first half of the day. For me personally, I do service at charter school. So in the mornings, I am down at the charter school. We're just starting getting schedules going, getting everyone's education plans together to see what is going on. So I have students that range from kindergarten to high school. I have a 12th grader, and just seeing them normally in 30-minute increments. It all depends on the kid. It all depends on their plan of care based off of evaluations, what have you. And the school system is typically half-hour sessions. Sometimes I see them in groups. Sometimes I see them individually. And then in the afternoon, I do move up into our office in the center, at the Hearing and Speech Center. And there I have many hats as a clinical director, but also I am still a practicing clinician. So I have a variety of patients. These patients are normally there on a couple times a week. So it's pretty typical. It tends to get a little bit typical in terms of who's on our schedule and who we see and who we know. So we know what their plan of care is. And then we just work on whatever goals are on the plan of care, on different ways to achieve those goals, and working with the child, communicating with the parent on what transpired during the therapy. Sometimes it does change up. Sometimes I have feeding patients. Sometimes I have children who are not having a good day, or where they're having sensory overloads, or they're just or having a great day. So then therapy sessions go pretty smoothly. I also do, as a clinical director, I'm listening out for the other clinicians to see if any support is needed within their therapy sessions, to make sure that they're doing okay. If they have any questions, or if there's a child that's having behavioral issues. I am a strict Jamaican person, so behavior is not really a problem for me sometimes. So I'm there to support them as needed, and then also doing other supervision work and working with the administration and our CEO, with projects that we have coming up. So it becomes a very busy day, but I think that's the great thing about it, is it's never a dull moment. I can be talking to an adult, and then next thing you know, I'm sitting on the floor with a 2-year-old, and we're learning how to communicate through play. So never dull.
Thank you. Yes, dealing with children, never dull. All right, Dr. Mccalla, if you could continue.
Well, my typical day, I start work normally around 10:15, 10:30. I don't like dealing with traffic, so I set my own hours since I work for myself. And I is from an optical, and I see a variety of patients. I see from about 4 years of age up. And when I deal with children, sometimes they have issues. Sometimes it's just a nearsighted and the distance is blurred. That's very easy for us to deal with. Sometimes they have trouble focusing, and they're doing poorly in school, and the teachers don't understand why, the parents don't understand why. They see fine, they appear to see well, but they actually have a very maybe farsighted by quite an amount, so that it requires a lot of effort for them just to see. And so they become behavioral problems because they're not seeing well. I also see a lot of diabetic patients because they need to have their eyes dilated and the retina looked at, because with diabetes, it's a very silent type of disease. When it affects the retina, you develop retinopathy, you're unaware that it's starting. You're unaware that you have a problem. And so we have to find out if the patient is having a problem and instruct them in what to do to reverse it. We see them back. If they're not reversing it and it's progressing, then we have to refer them to retinal specialists, where they intervene with certain types of treatments like injections in the eye and so forth. So you don't want to get to that level. You want to reverse it when we talk to you and tell you, look, it's time to work harder and fix the problem. I see contact lens patients. I fit soft lenses, soft toric lenses, bifocal contacts. I fit rigid gas permeable, which are the hard lenses. So those are things I typically do in a day. And during the summer, especially, I see a number of patients. Well, I shouldn't say a large number, but about a few every summer that are working, cutting grass, and they get a pedalette or a piece of a stone or a little something in the eye. Now, we are the emergency room for eye care. You can't go to urgent care. They're not going to help you. I'm sorry, urgent care people. They need a what they call a slit lamp or a biomicroscope. That's the real term, biomicroscope, to see if there actually is something there and what is going on with the cornea. To diagnose eye problems, you need the biomicroscope. That's why telemedicine doesn't work for our field. If you don't have that, you cannot make a correct diagnosis as far as pink eye, as far as an allergic problem, as far as a small particle in the eye. If it's embedded in the cornea, a piece of metal, we have to actually numb the eye and drill it out and remove it. Otherwise, it festers and becomes a problem. So we actually have to remove that particle if there's a part. We see a lot of mechanics under the car hammering. A piece of rust falls in the eye and they rub it and it embeds into the cornea. And now we have to remove it. You can't leave it there. So I see a variety of patients, and that's what I enjoy. It's always having to diagnose the problem. They're blurry. This eye is clear. This one's blurry. Why? What's causing that? It just started. How long ago? And so forth. We have to go through and make a diagnosis and come up with a way of fixing the problem, or refer them to someone who can help them, like an ophthalmologist who might need surgery. Let's say if it's cataracts, they're going to need cataract surgery. So that's my typical day. I see a number of patients with a variety of different problems.
So for those of you watching, as you heard Dr. Mccalla explain, please wear safety goggles. Even if you're under the car, whatever you're doing, please wear safety goggles. Not trying to put you out of work, doctor, but please, we want to save eyes.
Yeah.
Dr. Diaz, what do you do on a typical day?
A typical day of work, I'm seeing anywhere between 50 and 70 patients, just adjusting spines all day long. Some of you guys have gone to my office, and that's what we do. We have some massage therapists in our office too, but what I do is I'm adjusting spines, correcting vertebral subluxations, and like I said, I see patients from the womb. I see pregnant patients, and the neat thing about seeing pregnant patients, you're able to adjust their spine, see what's going on, and one cool thing about adjusting pregnant patients is that the C-section rate is so minimal when everything's well aligned. You see how everything functions properly and nice, simple bursts. And then to the tomb, I see patients, 95, 96 years old. I had a patient who was 100. She passed away a few years ago. But, anywhere from the womb to the tomb, we're seeing patients all day long adjusting the spine, correcting vertebral subluxations, correcting posture, the curve in the neck. Nowadays with technology, you see kids are starting to lose the curve in their neck. It used to be from whiplash when I first opened up, but now I'm starting to see everybody with holding these things in their hand, just looking down, losing the curve in their neck. So we're constantly correcting the spine. By correcting the spine, you see lots of things. And I'm very blessed to see all kinds of patients too. I mean, I've gone to the ICU, to the NICU, and I've adjusted premature babies. And it's an awesome feeling to see, when the mom's crying and thinking that the baby's not ever going to come out of the hospital, and when you start adjusting them and you see life start to work, the way that it's supposed to. And now some of these kids I've seen, are bigger than me. Not that that's saying much, but that's it's really cool to see how the body responds when everything functions properly. We have little babies. I had that a couple years ago. I remember a baby came home from the hospital, hadn't gone to the bathroom, hadn't done number two, and parents took him to the pediatrician. The pediatrician, gave him, some stuff, but nothing. So they said the next step, you have to take him. They might have to do surgery, and the parents freaked out. Had them. The grandparents were actually my patients and say, "Oh, why don't you send them to my chiropractor?" And the parents are chiropractic babies. They kind of didn't associate. They brought him to my office as a last resort. We just checked the baby's spine, did just minimal, contact, on the sacrum, and just adjusted it, and the baby pooped right there, in his diaper and everything. The parents heard it. And it was like, I've never seen parents so happy to see a baby poop. He was like 8 days old who hadn't pooped after he left the hospital. And it's incredible when you see, it's like turning on a switch. That's the only way I can see it. When you take the pressure off the nerve, it's basically turning on a switch, or turning on the light in the room. The body functions better, and you're so much healthier, and you see it all the time. I have patients who've had migraines for years. After we start adjusting their neck, corrected it, they never have a migraine again. It's awesome. I have patients come in who could barely walk, who walk out. So, and then I have patients coming in regularly for maintenance to make sure their body's functioning properly, so that they can be healthy regardless of what they're seeing, and like I said, I don't treat anything. I'll treat you guys to lunch. How's that? That sounds real good. But we correct the spine, the body functions, the body works miracles. And I love what I do. I love seeing the results that we see in the office. Uh, what else do we do? We take X-rays, and having owning my own office, like Dr. Mccalla said, I get to set my own hours. So I have I spread my hours. I go in at 9, but I take off the Latin break where I'm off from 1 to 4, and then I come back with 4 7 on Monday, Wednesday. So it's neat. I'm off Tuesday. I'm off Saturday, Sunday. I work 24 hours a week seeing patients, and I make a great living, and I love what I do. It's such an awesome feeling to see the results that we get in the office.
Thank you, Dr. Diaz. Eric and David, if you are watching, I hope you heard Dr. Diaz talking about, looking down at a device. Remember, mommy says, straighten up, and this is why. All right, moving on. I had to give the shout out to my kids because it's a never-ending battle here. Okay, our last question so far, I think it's my last question. What advice would you give to somebody who is considering your profession? Let's start with Miss Corrine.
Advice. One of the things that I would say is, especially everything in the medical field, I think in general, for speech pathology as well, this is a passion. It's do your research, make sure you understand kind of what you're going into, what some of it might entail. It's not just about salary, it's not just about location, but it's also like what does this mean? What is the passion? What is your why for being in this field? Make sure you understand that coming in. I have had, as a clinical director, I've had some instances, even a recent one, where I don't think that person really not really understood, but that they were convicted that this is what they wanted to do, and they were almost done. And because of that, you can see it in work ethic, you can see it in effort, you can see it in the dedication that they put into their work. It shows. And so really looking into speech pathology, is this what I want to do? Also, one of the big advice that I can give for those who are looking at schools, there are many different schools that have this program. Please make sure you're going into a school or searching schools that are more research based. As a clinical director, I have seen when we have different interns coming in for doing their either their clinical fellowship year or even doing like clinicals for that semester, I've seen differences in preparation, and I can attest that to the school and how rigorous the professors are, how knowledgeable, how dedicated they are to the research and their field. It makes a difference in how they impart that knowledge to you. So if you want to go into this field best foot forward, you have to look into a school that gives their best as well. So that's one of the biggest things when you're considering this profession. Really look into the school that you're going into, because that foundation is crucial.
Thank you. Thank you for that. Dr. Salmon? Dr. Salmon, I'm sorry, you're on mute again.
I'm sorry. For me, I would say that as a young individual, they really need to focus on academics first, because at an early age, it may not be possible to determine what the profession is going to be. So once you are fairly strong academically, then you'll have flexibility in terms of choosing a career. So it's important to focus on academics, maybe all the way through college. Once you have that, you can pick a profession based on your personal choices, your personal research, your personal liking, and other factors. But I would say that you should never choose a profession. You should really choose a profession based on the fact that you're going to enjoy it. Because once you're going to enjoy a profession and you have an advanced degree, you are going to be comfortable financially. You may not be wealthy, rich, but you may not be Bill Gates, but you will be able to have a pretty comfortable financial life financially. So always choose something that you are excited about, a career that you think that you can do pretty much 8, 10 hours a day, and every day you're going to work is as if you're not going to work. It's as if you're going to have fun, get out and have another fun day somewhere else, at home, at a sport, or whatever liking that you like to do. Research is very important. I have two nephews right now in medical school, and they're telling me that they want to be dentists. So I said, "What do you mean?" He's laughing. They're laughing. So we want to have a dentist hours. You want to work 20 hours a week, 25 hours a week, and no surprise calls in the middle of the night. That's their personality. That's fine. Other people would like to be more involved in medical care in terms of acute medical care, being called up at nights. So each person would have their own preferences. So the main thing is to choose something that you like. Once you like it, then you're gonna be good at it.
Amen.
Thank you. Thank you, Dr. Salmon. So far, I'm hearing a pattern that you need to have a passion for it. I'm sure Dr. Mccalla will agree. You can go ahead.
Yeah, I think that you have to enjoy what you do. I mean, if you don't like dealing with people, my profession is not the place to go. You have to really understand people. You have to know your patient, or you're not going to be able to be a good doctor, no matter what doctor, whichever field you're going to, because whichever aspect of medicine you're going to, because you have to understand what they want. For instance, I have patients who come in, they say, I see fine. You check them and the vision is blurred. They're just barely seeing well enough or not even able to pass a driving test. They're seeing fine. I don't want glasses. I don't want glasses. I just want to read. And then there are others that just the slightest blur. You tell them, do you know you don't need to change your glasses? No, I'm blurry. I am blurry. I'm getting a headache. I'm not seeing well. You have to know who you're dealing with. That's the first thing. So you have to understand people. If you don't if you don't understand people well, you're not going to do as well in my field. You have to be able to relate to people. You have to relate to people with money. You have to relate to people who are on the street begging. I get all those types of patients, a large variety. I get people who are so much money, I can't believe how much money they have. And I have some people who are so poor that I see them on the street panhandling. So you get a large variety of people. You get people who have good hygiene, people who don't have good hygiene. But you have to be close to them. You have to do things with them, and you have to be able to deal with all those things. But that's all part of it. And you just have to, if you like people and you like talking to them, you'll do fine. And if you're going to prepare yourself, learn. If you're doing well in school, continue to do well, but study people, learn about who they are, and also the last thing, study about not only medicine or science, learn about business. If you want to be your own boss, learn about business, take business classes, which I did. And I think that makes a big difference also in being able to be my own boss.
Good words. Thank you so much. Dr. Diaz.
Well, I'll follow the same motive we were all talking about. If you do what you love, you'll never work a day in your life, and you really have to have a passion for it. I love what I do, so it's I've been doing it for 27 years. I feel like I can go another 27 years, no problem. What I would say to someone who's considering chiropractic, make sure you get the grades first. That's the most important thing at first. But definitely, like Dr. McCullough said, I'll piggyback on that. business. I didn't take business courses, and I just had to learn. I learned from mistakes, and I know I made a lot of mistakes along the line. Now we're kind of stable and everything, but at first I made lots of mistakes. Another thing is I've had lots of people come and shadow me, and that's actually really cool when I have young high school kids or college kids shadow me around, and they're like, "Wow, I really like this." Or some say, "That's not for me," but it's neat to see. When people follow you, they make that decision. I had a young gentleman who actually went to GMA. He actually shadowed me, and he's actually starting chiropractic school now next year. So it's really neat to see. And I recommend that. Go shadow. I mean, I'm sure Dr. Mccalla, you've had people shadow you. I recommend that. Go shadow, and I have my doors open. Anybody can come shadow me because I love what I do, and we definitely show it.
Thank you. Thank you so much. Those are it on the questions that we had prepared, but I'm sure there's other questions that are out there. So if Pastor Brian I'm saying calling him doctor now, Dr. Brian. Okay, Gianni, at 50 years old, can one apply for medical school and become a doctor? Why not? Let's have the doctors.
I'll answer that question. When I was in school, we had two of my classmates were 40. They were in their 40s, and they actually finished. The oldest one, I was in his late 40s. He had gone to medical school for a year or two, dropped out, went into business, did well, was successful in business, but he wanted something else in life. He owned a home, the family had grown up and moved away. He went to optometry school, was in my class. And then he'd sit in the back, and sometimes he'd fall asleep, and he's like this, and his head's hitting the back of the wall, and you'd hear him snoring sometimes. And we just shake our head, Ronnie, that's Ronnie. And but he did well enough to make it through, and he actually practiced for a few years before he retired. I don't know if he made the money back on his education, but he was happy, he was content. You understand? That's what matters. His soul was fulfilled. And he was a great gentleman. Unfortunately, he passed away about a year and a half ago, but he was a real wonderful person and really funny. And the other one that's older is retired, and I keep in touch with him. He's now living in Texas, and every now and then he'll call me. And so he's an African fella. He did dentistry, actually. He did some parts of medicine, and then he did optometry. So there's so many different things that people do, and they switch off. Sometimes they find one area not fulfilling. It's okay to switch even later in life.
When I was in college, I had a professor who taught biology, college biology. He had a PhD. I don't know how old he was, but he had a PhD. That means, he has put a lot of time in his education. When I went back to school, say 10 years ago, I asked where someone said he went to medical school. He's finished medicine. He's now practicing medicine somewhere in Loma Linda area. So he must have been in medical school, maybe, I would say, mid-40s, probably got into medical school.
Yeah. When I started chiropractic school, I was one of the younger people. I went straight from undergrad to chiropractic school. But I was one of the younger. There's people who did their military career and then went to chiropractic school after college. There was an older gentleman, too. He was probably in his late 40s, early 50s when he started chiropractic school. And I was just, a young 22, 23-year-old, I remember. And he's retiring now, I saw, but he practiced. I mean, it doesn't matter, what age. Age is just a number.
Yeah, if you have the passion for it, if you have the the enthusiasm for it, why not? Definitely, you can go. All right, next question. I did see that there were several that popped up. Dr. Mccalla, what changes do you see in the future for your profession? Technological advances?
In my field, they're making leaps and bounds advances. They're moving along different types of equipment now. We have a visual field that normally was a very large instrument that checks peripheral vision. They now have one that looks like a pair of goggles that you wear to dive with. You put them in like a virtual reality thing, and it does the whole thing. So they've downsized it. They have instruments now that scan the retina that do some incredible things. In our profession, in the future, there are not enough ophthalmologists being trained. The number of ophthalmologists being trained in the United States have been the constant for the last 30, 40 years. There's a greater need for more people with vision problems, serious problems like retinopathy, diabetic retinopathy, macular degeneration. The numbers are increasing, and those people need injections in the eye. Our profession at this point, only a couple states are allowing optometrists to do it. But in the future, the entire United States, I can see that happening. We treat different eye diseases, and maybe and two states we can use lasers. I can see further on down the road where lasers, we will be doing some of the glaucoma treatments that are now done by ophthalmologists with lasers because there are just not enough ophthalmologists to handle the load. If you go to an ophthalmologist's office, you realize that you're going to sit there for 2 or 3 hours and before they even call you. So that's because there are just not enough of them to go around anymore.
Wow.
Wow. Same, I seem to piggyback on Dr. Mccalla a lot. Same thing with chiropractic. Right now, they say over 10% or a little bit less than 10% of the population has gone ever to a chiropractor. And they say that if it goes to 50%, it'll be we there's no way we can handle it. It's just not enough chiropractors. And the numbers are growing. People are, as it's expanding, people want to try chiropractic, and there's just not enough chiropractors. And you think there is because it seems like you see commercials and stuff, but there's really, I mean, if that number went from 10 just to 20%, we would be completely overwhelmed. There's really not enough chiropractors. So that we see. And as far as technology, chiropractic actually is Greek, which means with hands only. So, I mean, it's the same when it started. We use our hands. You guys have been to my office. I adjust with my hands. But there's, just my practice has just changed as far as digital, just the whole. I'm not computerly savvy, but my staff is, and they really run the office. It's all computerized. As far as the texting and going out, it's really neat to see. I just use my hands. But as far as diagnostics, we do use a thermograph. That wasn't around when I first opened up. X-rays. When I first started X-raying, we had the film where we put it in the fixer, the develop, and then we had a developer that would do it automatically, and now we've gone digital. So I mean, just in the time I've been practicing, I'm on my third phase of how it works. So I remember when I first opened up my practice, I saw there was a Star Wars Next Generation. I don't know if you guys ever saw that, but they were diagnosing somebody, and they had him standing like on a tube, and it was going around, and you could see his spine just spinning there. They were just looking at the spine, and then looking, touching the different. I'm like, wow, something like that in the future. I don't know what would happen, but it's really neat, to see the the possibilities of what we can do.
In, in my profession, it's also touched by an explosion of technology. We have technology, just like Dr. Diaz mentioned, digital X-rays, which is pretty much constantly changing. We have technology for detecting fractures in tooth. Many teeth are fractured and difficult to diagnose. There's technology for that. We have technology for detecting oral cancer in the oral cavity, which is also exploding. There's also a refinement of technology by way of simple things such as, for example, hand pieces we use. They're now electric driven, they're smoother, have a lot more torque, they're more efficient in cutting. There's technology in, for example, intraoral technology. You can talk to a patient. You can duplicate their mouths on a screen and have a decent conversation with the patient rather than saying, over here on the right side is a tooth with a big filling. And you can show them all this information on a screen, and they can actually make their own diagnosis. So there's an explosion in technology in every aspect of dentistry, from practice management to diagnostic, to treatment delivery, to implant. There's no such thing as insufficient bone. You can graft bone. You can build bone up to the volume where you need to place an implant. People are doing immediate placement implant. We get an implant the same day. So the field is just totally exploding, and to us, it may not be known by the public, but it's a very dynamically changing field.
Thank you.
In speech
Yes.
pathology, there there is a shortage. We need more. We need more therapists. Starting with students going into the profession. Some of the changes that we have been seeing, I'm pretty sure that has happened across the board, is that we've had to increase our advocacy for our profession, because we're having to fight more with things like insurances and everything to recognize our profession and recognize our diagnostic power, and the things that we do. We're having to fight harder and harder to be recognized, and so that's a tough one that I don't see that fight letting up anytime in the future. But we need more therapists in our field. There is a shortage. There's a shortage in the school system for therapists. There's a shortage in the private and nonprofit world for therapists. As far as technology, it depends on the certain aspect of the field that we're in. In the more pediatric, school-based, early intervention-based, our technology or toys. So toys and games. However, there are certain advancements in how we address certain diagnoses or certain goals, certain whether it's how we're addressing fluency or stuttering, how we're addressing early language development, how we're addressing certain articulation or language later on in the years. You'll see more of the technological advancements when we are collaborating more in the medical field, whether there are advancements with the passing years or with certain technologies for patients with Parkinson's, or patients who had a stroke and they're recovering, they have aphasia. There are more technological advancements in certain diagnostics, scans, more if we are collaborating with audiologists who are also part of our association, you'll see more advancements there with how the hearing aids are getting smaller, sharper, more cost efficient. So it all depends on what path you're in, but we're constantly learning, constantly growing in our understanding of the brain and how it affects communication, how it affects certain syndromes or genetics. So advancement is everywhere. We just have to keep up.
Yeah, keep up with it.
Thank you. Thank you for your responses. I believe I only see two more questions. How has coronavirus affected your job?
I can start with that. Actually, when we first started, when the pandemic first started last year, we had to shut down a couple of things. We had to stop massages, which we have massage therapists in our office. So they couldn't do massages from March until the end of May last year. We switched it. Those of you who got to my office, see, we no more cloth chairs at all, so leather so we can wipe them down. We're cleaning. Everything's being hygienically. We have to clean all the time. We're washing our hands. But our practice has exploded in the last year. It really has. This has been our busiest year. Why? The same thing I've been saying for 27 years. If you have a healthy spine, your body works better. If your body works better, you'll have a healthy immune system. If you have a healthy immune system, if you get sick, your body's going to be better, able to fight it off better if you're at 100% than if you're at 90%. And so patients have been coming in wanting to get their spine adjusted. I mean, no neck pain, no back pain. They just say, I just want to make sure my body is well aligned. And I've had almost 200 patients test positive. Not one has had to go to the hospital. I mean, minimal symptoms, but not one has had to go to the hospital. Not one has gotten really sick. So really simple. A body, when it's functioning properly, works miracles.
For me, practice being impacted by coronavirus. Of course, we've had to do more social distances, less patients in the waiting room, people are waiting in the parking lot and they're called to come in. More extensive sanitation of the rooms. The biggest impact really is the number of patients that we see. So now we tend to be doing more lengthy appointments to minimize contact. So if someone is coming in for dental treatment, if you can get something done in one visit, why get it done in 4 visits? Because each exposure to the environment, whether it's Publix or whether it's a gas station or whether it's a dental office, each exposure, you're pretty much exposing yourself to possible contraction of coronavirus. So the biggest impact we've seen is we tend to see to book for longer visits and do more procedures, so we have less contact with the patient. Um, Sanitation has always been there in our offices, and which has held up well over time through HIV and other issues. And actually, the infectivity rate for dentists, as far as one report shows, was like 0.3% for the coronavirus. So that means we're doing something right
Yes.
in terms of how we relate to the patient. The environment we work in is very scary. Even for me, you're working and you have all your protection, but just imagine if you could see all that mist that's being created from the handpiece drilling at 200 RPMs. All that mist it creates. What is happening to it? What's it doing? You know, it's kind of scary, but with good, apparently with good suctioning and good distancing and good protection for the patient and the practitioner, we seem to be okay. But it's a concerning environment to work in.
Um, for when the pandemic started, um, what I have seen, or what we have seen in, at least in Miami, and we've heard outside of Miami as well, a lot of private practices had to close. A lot of private therapy practices had to close, whether it was how it was managed before and then not able to keep up with the changes, or, the client list got too low, the productivity got too low. Um, One of the things that I think that we did at our office is that we started to see that a shift was about to happen, and we jumped on it. So, say for instance, a lot of us are in the school system, or in the charter schools. We didn't have webcams. We ran out to the Best Buys, got as many webcams as possible in order to shift with the schools. They were right before the lockdown, all the packages started coming in, because we understood that a shift to teletherapy was happening. And that is honestly, when we went into lockdown, our cameras came home with us, and what you see right now, this is how we started doing therapy with all of our patients. It was difficult. Our parents started to understand some of the things that we have to deal with, when they became our co-therapist, sitting next to their 3-year-old. And sometimes it does not work. Sometimes therapy online does not work for the child, and we understand that. We do what we can, and then we adjust. And then as things start to open up, those are normally the first patients that came back in, those where online was just not working. And so what we just became flexible during this whole time, became more rigorous with cleaning of the toys, shifting the types of toys that we would use, um, making sure that in between patients everything was wiped down. The toys that was clean, that was played with, those were put away to the side to be properly sanitized, and then we have another set of toys for the next kid, or what have you. And we learn to be very flexible. You learn to adjust where adjustments needed to happen in order to thrive in the
Yeah.
middle of all of this, in order for us to feel safe, and also for the patients to feel safe, for the parents to feel safe in coming back in. So, and it, by the grace of God, it has been, we have not had to close down,
Amen.
For
and we
me,
have not had any, sorry, we haven't had any um, um, like in infections with like patients and things like that. So
Yeah, for me, we did basically a lot of the same things with the social distancing, a little bit more cleaning of the chairs and things in the waiting room. We actually did close to regular patients for about 2 months. And I would see only patients who had emergencies, red eyes, infections, glaucoma patients that they had to be seen at a certain interval. Whatever the problem may be, certain patients you have to see at a certain period of time. You can't let it go beyond that. So those patients I saw. And then I went back to seeing regular patients after about 2.5 months. Slowly we increased, and we've been swamped because we have patients who have come in for now. Some people come in 2 years instead of coming in every year. And so now it's their time to come in. And then you have those that didn't come in last year, and then the ones who want to come in this year. And so we are overworked right now. And our hours I haven't opened up my hours fully because when I walk into the building, before I walk in, I put a mask on. And I don't take my mask off until I walk out of the building. We don't eat lunch in there like we used to, and so forth. So we shorten it. So we go through, finish the day, and go home and eat lunch. And so that is less likely to transmit to people in the office, and because we just don't know. And so because of all these unknowns, we've learned more and more as we've gone along. Fortunately, I haven't had a patient who's had an eye manifestation from COVID, but it can affect the brain, it can affect the optic nerve, you can get swelling, all kinds of issues going on. You can have COVID in the cornea itself. So we fortunately again have not had that happen, but and we have not had a case where had a transmission in the office that we're aware of. But so we always try to be very careful. But we just it is COVID, and with this variant, we have to be even more careful, I think.
And I think there's one more question that I am seeing here pop up on YouTube. And this is for Dr. Mccalla. What is the difference between optometry and ophthalmology? Did I say that right?
Yeah, ophthalmology. Basically, you can think of it, optometrists are the general physicians for the eye. We do a host of various eye issues. We treat a lot of things, we prescribe medicine, we do everything except surgery. Ophthalmologists do the same things and they do surgery. They don't like to do the general eye care because they make their money off of surgery, and there are just not enough eye surgeons to go around. And so we end up doing the brunt of everything else, mostly everything else. But because there's a shortage of those eye surgeons, we are expanding more and more towards doing some of those surgeries, those minor surgeries, because we've been treating eye diseases like glaucoma for years. We've been doing a lot of the other things, the diabetics, and we've been doing all of those things. So our scope is slowly expanding, and theirs is maybe shrinking a little bit because they just don't have enough of them. So to train an ophthalmologist takes so many years and so much to do that it's very difficult to expand that. And so that's the difference. Really, we are the general GPs. If you have emergency problems, come and see us. Come and see us first. It's easier to get into our office. And then if it's something that you need to be referred for, we send you on to the ophthalmologist.
Thank you so much for that explanation. I believe those were the last questions. You're welcome. You're welcome, Dr. Mccalla. Yes, we appreciate all the information that you have given us. If anybody, watching has any questions, you can always reach out to us in the health ministry. It's, I think, health@miamitemple.org is the email you can send your questions to, and we could reach out to the panelists and let them know. And for those of you watching, I hope your questions were answered. For you young people watching, I hope these discussions have helped in making decisions on, you know, what career path you kind of are looking at. But as many of the panelists mentioned, you can come shadow them. Sometimes it's okay. It's okay to switch from one career to the other, from one specialty to another one. It's okay. It's all part of life, and it's all part of growing. So thank you for joining us. And we hope to see you next time. Have a great day, guys.
Thank you.